There are 5 surgeries that doctors perform every single day across this country. Common surgeries, surgeries that most people assume are straightforward and safe, and for younger patients, many of them are. But after the age of 65, the risks around these particular procedures change so dramatically that if it were my own parent sitting across from me, I would want them to hear everything I am about to share before they ever agreed to go under the knife. This is not about scaring you away from medical care. Surgery saves lives, and I believe in it completely. But there is a conversation that happens too rarely between doctors and their older patients. A conversation about what surgery actually does to a body that has been on this earth for 65 or 70 or 80 years, about the risks that multiply quietly with age, and about the alternatives that exist which most people never get told about because nobody took the time to explain them. I am Wesley Harper, and today we are having that conversation. If you are over 60, or if you have a parent or loved one facing a surgical decision, please stay until the end. What you hear today could genuinely change the outcome of that decision. Before we get into the 5 surgeries, there is one concept I need you to understand first, because without it, nothing else I say will make complete sense. The concept is this: age on paper means very little when it comes to surgical risk. What matters far more is something doctors call frailty. And frailty is not about how old you are, it is about how much reserve your body has left. Think of it like a phone battery. When you are young, your battery is at full charge. You can run it hard, drain it down, and it bounces right back. As we get older, that battery capacity naturally decreases. You might be functioning perfectly in everyday life at 70 or 75, getting around fine, cooking, gardening, doing everything you normally do. But your reserve capacity, the ability to absorb a major physical shock like surgery, has quietly reduced over the years. Surgery is one of the biggest physical shocks a body can experience. The anesthesia alone puts enormous demand on the heart, lungs, kidneys, and brain. Add a major incision, blood loss, infection risk, and days of immobility, and you have a combination that a younger body handles very differently than an older one. Doctors can measure frailty with simple tests: walking speed, grip strength, how quickly someone recovers from a minor illness, and what the research shows consistently is that frailty is a far better predictor of surgical complications than age alone. A frail 68-year-old faces far greater risk than a robust 78-year-old. This is something every older adult and every family member needs to understand going into any major surgical decision. There is also a critical difference between planned surgery and emergency surgery that I want you to keep in mind throughout everything I share today. Planned surgery gives doctors time to prepare the patient, optimize their health, and weigh all the options carefully. Emergency surgery is a different situation entirely. It happens under pressure, with no preparation time, in a body that is already in crisis. Complications, mortality rates, and recovery difficulty all increase significantly when surgery happens as an emergency rather than a planned procedure. And this distinction is going to matter a great deal as we go through these 5 surgeries. Let's start with the first one: colon surgery in an emergency setting. Specifically, when a portion of the colon has to be removed urgently because something has gone badly wrong. This might happen because of colon cancer that was not caught early enough, or because of a condition called diverticulitis, where small pouches in the colon wall become inflamed and eventually perforate. When colon surgery is planned and performed minimally with small incisions, the risks are manageable and recovery is meaningful. But when it becomes an emergency, the picture changes completely. If one of those pouches ruptures, or if a tumor blocks the intestine entirely, the contents of the bowel spill into the abdominal cavity. What follows is a severe and life-threatening infection called peritonitis. The patient arrives at the emergency room in serious condition, and surgery cannot wait. For an older adult going through this kind of emergency operation, the statistics are genuinely sobering. Complication rates multiply dramatically. Mortality rates in high-risk emergency abdominal surgery can exceed 25% in frail older patients. That means 1 in 4 people in that situation does not survive. And those who do survive often face weeks in intensive care, serious muscle loss, and a recovery that may never fully return them to where they were before. The tragedy is that this scenario is almost entirely preventable. A routine colonoscopy, starting around age 45 to 50, allows doctors to see the entire colon and remove small growths called polyps before they ever develop into cancer. It is a procedure done under sedation, typically taking less than an hour, and it can eliminate the need for major surgery entirely. Catching colon cancer early or preventing it altogether through regular screening is one of the most powerful things an older adult can do for their long-term health. A diet rich in fiber, fruits, vegetables, and lean protein also plays a real role in reducing colon disease risk, and there are warning signs that should never be brushed off as normal aging. Blood in the stool, a persistent change in bowel habits, abdominal discomfort that does not resolve, unexplained weight loss. These are signals your body sends before a crisis develops. Do not wait for a crisis. Get screened. Now let me tell you about the second surgery on this list, because this one surprises a lot of people. Repairing a perforated stomach ulcer. A stomach ulcer is essentially an open sore in the lining of the stomach or the upper part of the small intestine. The two most common causes are a bacterial infection called H. pylori and the long-term use of anti-inflammatory pain medications. And that second cause is one that affects a very large number of older adults, because medications like ibuprofen and naproxen are commonly taken for arthritis, joint pain, and back pain. These medications, while helpful for pain, can break down the protective lining of the stomach over time. Most ulcers, when caught early, respond well to medication. Acid-reducing drugs allow the ulcer to heal. Antibiotics clear the bacterial infection if that is the cause. The vast majority of ulcers never need surgery at all, but when an ulcer is ignored or not diagnosed, it can deepen until it perforates the stomach wall completely. Gastric acid then spills into the abdominal cavity, and the result is an immediate surgical emergency. Patients describe the moment of perforation as the most severe pain they have ever felt in their lives, and by the time surgery happens, infection has already begun spreading. For older adults, this emergency surgery carries risks very similar to what I described with the colon. The body is dealing with both a major infection and a major operation at the same time. Recovery is prolonged and difficult. Complications like kidney problems and lung issues are common, and again, this is almost entirely avoidable. If you are over 65 and taking anti-inflammatory medications regularly, please have a direct conversation with your doctor about stomach protection. A simple acid-reducing medication taken alongside the anti-inflammatory can protect the stomach lining and dramatically reduce ulcer risk. That one additional pill could prevent a life-threatening emergency down the road. And if you are experiencing persistent heartburn, burning stomach pain, or you have noticed dark or black-colored stools, do not wait and do not self-treat with over-the-counter antacids for months. These symptoms can indicate an ulcer that needs proper evaluation. An upper endoscopy, where a doctor looks directly at the stomach lining with a small camera, can diagnose and even treat certain ulcers in the same procedure. Getting checked early is always the right choice. The third surgery is one that involves the small intestine, and it tends to happen in people who already have some cardiovascular history. Emergency small bowel surgery. The small intestine is where most of our nutrient absorption happens. When part of it becomes blocked or loses its blood supply entirely, surgery becomes unavoidable. Loss of blood supply to the intestine, a condition called mesenteric ischemia, happens when a clot blocks one of the arteries feeding that tissue. It is more common in people with heart conditions, irregular heart rhythms, or blood clotting issues. When a section of the small intestine dies from lack of blood flow, it has to be removed surgically, and this is one of the highest risk abdominal surgeries for older adults. The connections made between the two remaining ends of the intestine are more fragile in older patients, especially those who are malnourished or who have underlying health conditions. If those connections do not hold, a second emergency surgery becomes necessary. If too much intestine has to be removed, a person may need intravenous nutrition for the rest of their life. What makes this so dangerous is how easily the early symptoms get dismissed. Abdominal pain, nausea, and some vomiting can sound like so many minor things. A stomach bug. something that did not agree with you, and so people wait. A day, maybe two. By the time they come to the hospital, the damage is already severe. For anyone over 65 with cardiovascular risk factors, persistent abdominal pain that does not resolve is not something to wait out at home. It needs to be evaluated promptly. A CT scan can give doctors the information they need within minutes to determine whether something serious is happening. And for people with atrial fibrillation or other heart rhythm conditions, staying consistent with prescribed blood-thinning medications is one of the most important ways to reduce the risk of a clot traveling to the intestinal arteries. Controlling blood pressure, blood sugar, and cholesterol all contribute directly to protecting the blood vessels that supply the intestine. The connection between cardiovascular health and digestive health is more direct than most people realize. Now we come to the fourth surgery, and this is one that many people are genuinely surprised to see on this list: the appendix and gallbladder. Both are common surgeries, both are considered routine, and both become dramatically more dangerous when older adults wait too long to seek care. Appendicitis and gallbladder inflammation both begin with pain in the abdomen. In a younger person, these conditions tend to announce themselves clearly. The pain is sharp, quickly worsening, and sends people to the hospital within hours. But in older adults, the symptoms can be much more subtle: a mild ache, slight nausea, no significant fever, easy to dismiss as indigestion or something minor. And so people wait. The waiting is where the danger lies. When the appendix or gallbladder becomes infected and inflamed but is not treated, it can rupture. And a ruptured appendix or gallbladder releases infected material throughout the abdominal cavity. What was an hour-long laparoscopic procedure now becomes major emergency surgery. The cavity has to be opened, irrigated, and drained. Recovery goes from a day or two to weeks in the hospital. And mortality, which is extremely low with early surgery, increases sharply when perforation has already occurred. The lesson here is straightforward but important. In an older adult, new abdominal pain that persists beyond a few hours deserves medical evaluation. Not tomorrow, not after the weekend. That day, a simple ultrasound or CT scan can identify the problem quickly. And early laparoscopic surgery, when it is still a minor procedure, gives older adults the best possible chance at a smooth and rapid recovery. Do not let the desire to avoid a fuss or not bother anyone delay a trip to the emergency room. The difference between early surgery and emergency surgery for these conditions can literally be the difference between going home the next day and spending weeks critically ill. Drop a comment below if you or someone you love has been through one of these situations. Your experience matters to this community, and I genuinely read every single comment. The fifth surgery is one that affects enormous numbers of older adults and carries risks that are rarely discussed openly. Major surgery without proper preparation. This includes significant chest surgery and hip replacement after a fracture. Both of these procedures are often necessary, and both can be genuinely life-changing in positive ways when approached correctly. The problem is not the surgery itself. The problem is when it happens to an older adult who has not been prepared properly for what their body is about to go through. Hip fractures are one of the most serious health events an older adult can experience. A simple fall, the kind that a younger person would walk away from, can fracture a hip and lead to major surgery. And the statistics around hip fractures in older adults are ones that more people should be aware of. A meaningful percentage of older adults who suffer a hip fracture do not return to the same level of independence they had before. Some decline significantly in the months following surgery, not always because of the surgery itself, but because of complications that come afterward. Pneumonia, blood clots, the confusion that can follow anesthesia, muscle loss from days of immobility that in an older body can be very difficult to regain. But here is something genuinely encouraging. When older adults go into major surgery well prepared, the outcomes improve dramatically. There is a concept in medicine called prehabilitation, and it is exactly what it sounds like. Instead of simply scheduling the surgery and waiting, patients go through a specific preparation program in the weeks beforehand. Supervised exercise to strengthen the muscles they will rely on during recovery. nutritional support to ensure the body has what it needs to heal, assessment and optimization of any existing health conditions, psychological preparation so the experience is less overwhelming. The research behind prehabilitation is solid and growing. Patients who go into surgery stronger, better nourished, and better prepared experience fewer complications, shorter hospital stays, and faster recoveries. The surgery itself does not change. What changes is the body going into it. If you or someone you love is facing a planned major surgery, please do not simply accept a date on a calendar and wait. Ask the surgeon directly. Is there a preparation program we can follow before the procedure? What can we do in the weeks ahead to improve the outcome? A good surgical team will welcome that question. And being an active participant in your own care, rather than a passive recipient of it, genuinely changes results. So let me bring all of this together. 5 surgeries. Colon surgery in an emergency, a perforated stomach ulcer, emergency small bowel surgery, a ruptured appendix or gallbladder, and major surgery without preparation. Each one of these has a common thread running through it. In almost every case, the severity of the situation could have been reduced, or the emergency avoided entirely, with earlier action. A colonoscopy scheduled instead of postponed, stomach symptoms evaluated instead of managed with antacids for months, abdominal pain taken seriously instead of waited out at home. A preparation program followed before a major planned operation. The operating room is not the enemy, delay is the enemy. Lack of information is the enemy. Going into a major medical decision without understanding how the calculus changes after 65 is the enemy. Your body after 65 is not weaker in a way that should feel discouraging. It is different in ways that simply require a different kind of attention and preparation. The same care and intention you bring to everything else in your life, brought to these health decisions, makes an enormous difference. If someone in your life has a checkup they have been putting off, a symptom they have been dismissing, or a surgery coming up that they have not thought to ask questions about, please share this video with them. It might be the conversation that changes how they approach that decision. Subscribe to this channel if you have not already. Every single week I bring you honest, practical health information built specifically for older adults. No confusion, no unnecessary alarm, just the kind of clear information that actually helps you make better decisions for yourself and the people you love. And leave a comment below. Is there a surgery you or someone close to you has been concerned about? Has anything in today's video opened up a question you had not thought to ask before? I want to hear from you. Take good care of yourself. You have worked a long time to be where you are. Protect that. I will see you in the next one. Just remember, this video is for educational and informational purposes only. Always talk to your doctor or healthcare provider before making any changes to your medications, supplements, diet, or health routine.